So, Doug, with regard to diabetes, does it affect the eyes? How does it affect the eyes?
Diabetes diabetes is the leading cause of blindness in a working age, and it wreaks havoc on the eyes. Diabetes.
And by working age, you mean prior to 65?
Yeah. Diabetes affects the retina and the kidneys the most. If you think about your whole body, diabetes damages blood vessels in your whole body, but it damages certain blood vessels more than others, and it usually damages very small, thin blood vessels, which are found in the eyes and the kidneys. And that's why those organs are more susceptible to diabetic damage than others.
Interesting.
Yeah. And again, just like we were talking about cholesterol, like we were talking about blood pressure, you can look in someone's retina and see diabetic changes. And that bleeding pattern or that changing pattern in the retina looks a little bit different for diabetes than it does for blood pressure, than it does for this disease or that disease. And you can show eye doctors pictures of eyes, and they can tell you that's diabetes damage or that's blood pressure damage, et cetera. So when I see a patient who's diabetic, I ask them, how's the sugar doing? How's the control doing? And then I look at their eyes. And even if their control is very good, if you've had diabetes for a while, sometimes you still see problems in the eyes. That's why it's so important to keep on your blood sugar control, because even if you feel good, even if you feel okay, just a little bit of changes in elevation in your blood sugar over a long enough period can still cause problems in your kidneys and in your retinas, despite you being and feeling relatively good and relatively healthy.
So it's your eyes are more responsive to it than pretty much anything else.
Yeah, they're exquisitely sensitive. The retina is exquisitely sensitive to changes in blood sugar. You can also get changes in your refraction or changes in your glasses from blood sugar. A lot of times someone will come in, they've been diabetic, or maybe they've been borderline diabetic or pre-diabetic, and suddenly they come in and say, I can't see, my vision's blurry. You do a refraction, you find that they're so much more nearsighted than they were just a year ago, dramatically more nearsighted. You can prescribe them glasses, but you think to yourself, why did this happen? People come in, sometimes they change, but they don't change this dramatically. One of the things that we'll order is a blood sugar test. And if the blood sugar is acutely dramatically elevated, that answers your question about why that happened. Because sometimes the sugar, or what they call the sorbitol pathway, sugar can enter the lens itself, and that swells the lens. And then that creates almost like an artificial cataract, or increase in your myopia, or increase in your nearsightedness. Your sugars go down, that fluid comes out of the lens, and your glasses prescription comes back to what it used to be.
Hey folks, connecting with your benefits is our primary mission, and the SITREP is providing more options than ever.
Subscribe to our free email newsletter, subscribe to our audio podcast channel, or subscribe to our content on YouTube.
For details and links, check out the description below.